Okay, there we go. So first of all, thank you so much everybody for joining us today. This is day 5 of our caregiving education series, and we are joined by two presenters from CNIB, Brett and Joanne, and we are excited to hear what they have to tell us about today. And we invite everybody, if you have questions throughout the presentation, to go ahead and unmute and ask, or alternatively, if you don't want to be on the recording, you can also ask at the end, or pop it in the chat, or you can send either myself, Kyla, or Kayla a message directly if you want to be anonymous with your question. I also just want to do a land acknowledgement for us to start us off. So, in the spirit of reconciliation, we want to acknowledge that Manitoba is the traditional lands of the Cree, Ojibwe, Oji-Cree, Dakota, and Dene people, and the homeland of the Métis Nation, and we are on Treaty 1 territory. Okay, so I'm going to pass everything off to CNIB here.
Good morning, everyone. Thanks so much for having us today. My name is Brett Cleghorn. I am team lead programs for Manitoba, based in Winnipeg, and I'm joined here with my colleague.
Hi, my name is Joanne Fabian, and I'm one of the program leads that works at the CNIB.
So I've been with CNIB now for coming up on 5 years, and I've held many different roles with the organization. I started off as a program lead, overseeing a variety of different programs, community engagement, overseeing VisionMate, volunteers, and a number of different peer support programs as well. I'm currently in a team lead position, as I mentioned, and I'll let Joanne speak to her experience.
And for myself, I've been working with the CNIB for a little bit over 9 years now. But prior to that, I've been a participant / client of CNIB services for more years than I care to disclose. It's been a couple decades and maybe a bit more.
Okay, so I think we'll get started now. So CNIB, changing what it is to be blind. So our organization was founded in 1918. It is a non-for-profit organization driven to change what it is to be blind. We deliver innovative programs and powerful advocacy that empower people impacted by blindness to live dreams and tear down barriers to inclusion. Our work as a foundation for the blind is powered by a network of volunteers, donors, and partners from coast to coast. So nearly all of our programs are run and complemented by volunteers. Without the volunteer support, our programs wouldn't be available to our clients. Our mission is to change what it is to be blind through innovative programs and powerful advocacy that enable Canadians impacted by blindness to live the lives they choose. Next slide. Program areas. So we have a variety of different program areas. So first area would be Live, which includes VisionMate. So VisionMate is a program where volunteers are matched with clients to support either with friendly conversations over the phone on a weekly basis or to help them in the community or in the home with daily tasks. It could be things as sorting the mail, answering emails, organizing their home, or going out into the community to stores to help with shopping and things of that nature. We also have a variety of peer support programs. For instance, we have a Friday morning coffee group, which is actually running right now, meeting on Fridays. It's a group of individuals from about 15 to 20 of them. They meet regularly and just engage in friendly conversation and support one another. Joanne has a couple of other peer support programs.
Yeah, so some of the other wellness and recreational programs that we offer is we have a brunch club, and they meet at a different restaurant the first Monday of the month. Again, as Brett mentioned, mostly all our programs are facilitated by volunteers. So us as program leads, that's a big part of our role, is onboarding different volunteers that would be suitable for these programs. I also run a peer support program that's some of you may be interested in if you have new clients that are referred to you that are new in experiencing sight loss or maybe new to the services of CNIB. It's called Adjusting to Vision Loss. It's a 4-week program. It runs for 2 hours every Tuesday. And every week we bring in a different specialist and they talk about the different rehabilitation services through Vision Loss Rehab Canada. In addition to that, we talk about a lot of different concessions that are available to people with sight loss. A lot of people are not aware of concessions such as the disability tax credit or the primary caregiver or redemptions for if you're flying for companion rates. So things such as that, like concessions, people are not fully aware of all the different resources that are available to you living your life as a person with sight loss. I also, once the 4-week session is completed, because that one is based on peer support. So we don't offer per se counseling sessions here at CNIB. However, we do offer the peer support. So we have that 4-week program and that runs 3 times a year. We have one in the spring, one in the one in the fall, and then one in the winter. When a person completes that program or at any part in their journey of sight loss, they can join a program called our Life Coaching Series. And that program runs once a month. It's on Thursdays and it's in the afternoon. And it provides a continuum of the adjusting to vision loss. So now you're familiar with the different resources and connected to Vision Loss Rehab Canada. And now you're just living your life and managing with sight loss, but it's still good to be connected with a peer support group. And that's where the life coaching session comes into place. We have a new program coming up that's called our Adult Recreational Club. However, I'm not sure what age group that you service. The age target for this group is 30 to 60 years old. So it's meant for people that are a little bit younger and that they might want to do different things like go to Rumors Comedy Club and such. And so that program runs once a month. They meet here on once a month, and then on the alternative months, they're out in the community. But in addition to the Adult Recreational Club, I also run outings every year. And yeah, they're quite popular. We do different things such as I like to target on some of the barriers in which people with sight loss have, and that is transportation is a big thing. So we like to plan outings that are outside of the city limits. So we do different things like we've gone out to Birds Hill, to the riding stables, and to the beach. We've gone to Grand Beach. We've done the casino. So a number of different things. Gimli, we go to Gimli every year. So Gimli is a popular one of our hallmark trips that fills up quite fast. So different outings. In addition to that, I also have another group. It's called our Lights group, and Lights stands for Live Theater Entertainment Group. And this group's pretty cool in that we only pick venues that are accompanied by view services. And for those of you that are not familiar, view services is a live described services that provides live description of the production taking place. So similar to the described contents that you might access if you're going to a theater as a person that's blind. You can ask for a headset because you need described services. So it actually tells you what's going on, on the stage and the things that a companion would do. but you're not disturbing others by chatting and that. So it's a great service and we want to promote it. So we've this year we've gone to Manitoba Theatre Center, we've done Life of Pi, Murder on the Orient Express, and there's many other productions as well as venues that are offering this service like Prairie Theatre Exchange. Prairie Theatre Exchange, for those of you that might not be aware, they offer a companion rate. So if you're a person with a disability, regardless of the disability, if you disclose that, you will get not only you pay for your ticket, but your companion gets in free. So it's the same as the movie theater as well. So that program is gaining in popularity. Yeah, so it's a little bit of a synopsis. We have many other programs, and I believe that our newsletter was circulated to everybody. But if you have questions, feel free. I'll let Brett go on here.
Yeah, no, absolutely. Thanks, Joanne.
Yeah.
So not only do we have programs running, throughout Winnipeg, as it relates to peer support, but we also have different rural programs that run outside of Winnipeg, such as Brandon Connects. We also recently started one in Dauphin, and we have a number of virtual programs as well that offer peer support to our clients. Speaking of children and youth programs, Next Generation, we have dedicated staff to different program areas. As mentioned, Joanne oversees peer support and sport and recreation. We have a children and youth Next Generation lead that oversees all the children and youth programming. We have an advocacy lead, and we also have somebody that's overseeing mobile hubs, and I'll get into that a little bit later, and wellness programs. So for Learn Children and Youth programs, we offer a variety of different programming, one of which would be Youth Adventure Club from grades 6 to 12. We offer a Young Adult Social Club for the older youth, Discovery Saturdays from ages 7 to 12. We recently implemented PD days to support on those professional development days where kids are off. They can come into CNIB for a full day of programming or even visiting offsite venues as well. So lots going on, and we're really busy right now planning for our summer camps. So we have a number of different summer camps. We're actually planning on sending out 10 kids to Lake Joe, which is based in the Muskokas in Ontario. So it's a full day camp. They'll be accompanied by a staff for a full week. And that's something that we're really excited about. We have children's camps, youth camps, and a complex needs camp. So those will be taking place throughout July and August, and keeps us very busy during the summer months. As it relates to work, we have the Come to Work program. For tech, we have a Smart Life store, which has a variety of different items for sale. The store is based in the Winnipeg office, everything from liquid level indicators to handheld magnifiers to high-powered, very technological magnifiers. So I highly encourage you, if you would benefit from any of these devices, to come take a look at our store or even check out the website. We also have a program called the Phone It Forward program. So that's one of the programs that I oversee. It's designed to equip clients with technology to increase independence. The phones are set up by CNIB leads, and trainings provided by our sister organization, Vision Loss Rehabilitation. And we'll touch on that a little bit more as we get through the presentation here. So the iPhones provide a variety of different accessible apps that can make life easier for anybody that is blind or partially sighted, such as Be My Eyes, Seeing AI, or Blind Square. So we want to ensure that anyone who's blind or partially sighted can benefit from safety, independence, and enablement that a smartphone, along with proper training, can provide. So that is a little bit about the Phone It Forward program. And Joanne touched on play and a number of different social programs in sport and recreation. And then, of course, we have our CNIB Guide Dogs program. Next slide. CNIB Smart Life. So Smart Life is the largest retailer of assistive products for people with sight loss. You can shop for products online or at the Smart Life store. The Winnipeg store, as I mentioned, is located at the CNIB office at 1080 Portage. And we offer products such as white canes, talking clocks, watches, magnifiers, large print playing cards, liquid level indicators, a variety of different items, small scale to large ticket items. And I encourage you to come and take a look at the store if you do have the opportunity.
I'm going back, I just want to revert back to the last slide when Brett talked about mentioned the guide dog program that we have. It is relatively new here to us in Canada, specifically for the CNIB. And I just want to let people know that there is no age barrier. So if you do have clients that are seniors, it's based on ability. So it's the same as driving, right? So this is a mobility device as long as you're cognitively able to manage a dog as well as be able to travel safely and independently on your own. That is one of the criteria that you need to qualify that you can manage walking around independently with a cane first. So you have to have those skills first in order to qualify for a guide dog. Okay.
Okay, next slide. So CNIB guide dogs, partnered with an individual with sight loss, the dog helps their handler avoid obstacles and negotiate traffic. The handler provides directional commands. The dog ensures the team's safety. We believe everyone who would like to have a guide dog should have the opportunity. At CNAB Guide Dogs, we raise, train, and match dogs with Canadians who are blind or partially sighted. Next slide. So our sister organization, Vision Loss Rehabilitation Canada, so they essentially handle the clinical side of things. So at one time we were amalgamated, but we have somewhat separated, I guess, in 2017. So VLR, the acronym Vision Loss Rehabilitation Canada, is a not-for-profit national healthcare organization and the leading provider of rehabilitation, therapy, and healthcare services for individuals with sight loss. So they have a variety of different specialists from the first point of contact, the client care navigator, to orientational mobility specialists, to tech specialists, to independent living specialists. So they have people that will actually go and visit you in your home and support you as needed or in the community.
And those services as a person with sight loss, I just say from personal experience, make a profound difference in your quality of life if you're able to manage your life skills, your activities of daily living more independently. And their specialists will give you tips and training as to how to do that. When we mentioned Phone It Forward, we distribute CNIB, we distribute phones to individuals. However, vision loss rehabilitation can actually train a person. So sometimes the person might be a little hesitant to getting a smartphone because they don't know how to use it. That's when vision loss rehabilitation can come in and actually assist a person on training on how to use that skill or other smart devices. There's so many smart devices, especially with technology evolving with artificial intelligence, and the new glasses, the smart glasses are pretty amazing. But yeah, I just wanted to let people know. So that's a few examples of how we work together with vision loss rehab.
Yeah, and there's a lot of overlap between our clients. So, we collaborate in a lot of different ways as well.
Yeah, our programs definitely complement each other. So one covers the medical, the rehabilitation piece, right? And then we come in with more of the peer support and the actual cultural programs.
Social services.
Social, yeah.
And actually, VLR is based in our office too. So we share a space with them. So CNIB's strategic direction. The Way Forward, which started as an initiative in 2023 and is running currently up until 2028, our strategic plan, removing barriers today, tomorrow, together. So our three strategic commitments, one is attitude is everything. Two, safe and accessible journeys. And three, our kids will thrive. Attitude is everything increases understanding of blindness, dispelling misconceptions about people who are blind, partially sighted, or deafblind. The greatest challenge of our community members isn't what they can or can't do, but what the rest of the world believes that they can or can't do. Number two, safe and accessible journeys. Create accessible transit options and make travel safer for people with sight loss. Inaccessible transportation systems and built environment barriers put Canadians with sight loss in dangerous and stressful situations when traveling. So we've done a lot of work with regards to this pillar. We've done town halls and ride-alongs with transit in both Winnipeg and Brandon. And we're trying to move the needle forward to make essentially transit more accessible to people with disabilities. Number three is our kids will thrive. Give parents and children the support they need to excel in and out of the classroom. We want to influence change so that children who are blind or low vision have the same opportunities as their sighted peers. So one initiative that we've taken on is that we've been trying to promote universal eye screening for all children, and we've actually lobbied at the legislature a couple of years ago and tried to work with the Minister of Education. So a lot of work's been done behind the scenes. And some exciting new news. I did mention we have a mobile hub program, essentially where we will host an extensive menu of program offerings, giving people the chances in rural communities to take part in tech programs or peer support groups or advocacy. And we also demonstrate Smart Life products and demos of the items that we sell in the store. And another exciting add-on or complement to this program is we're now going to be doing some eye screening. So we have an eye screening device that we're going to be implementing. So the vision screening program at the mobile hubs is a community-based initiative designed to identify potential vision concerns early and connect individuals to appropriate eye care and support services through accessible, non-invasive screening. CNIB helps reduce the barriers to vision health and promotes early intervention. So it's like a camera and it takes a picture and it identifies different eye conditions and whether or not you should seek further assessment. That basically sums it up. So the goal of the program is to detect potential vision challenges early, reduce barriers to accessing eye care, because as you know, there are a lot of barriers to people living in rural communities, such as transportation, as Joanne touched on. Also increase awareness about the importance of routine eye health and connect individuals and family to local eye care professionals. We've also done a lot of work in terms of reconciliation. Reconciliation must be a priority for all Canadians, and CNIB is committed to being a part of this important journey. CNIB recognizes historical wrongs in Canada's past and will work to create a better future by addressing the challenges of today. We're committed to reconciliation by ensuring the work we do is built on relationships, partnerships, and guidance with First Nation, Métis, and Inuit people, co-creating a shared future, ensuring rights, equity, and well-being. So our vision, deliver innovative programs, powerful advocacy across the country to empower First Nations, Inuit, and Métis people impacted by blindness to live their dreams and tear down barriers to inclusion. So when we're traveling through these mobile hubs, we try to reach the First Nations communities. We've gone as far north as Thompson and Flin Flon this past summer, and we plan on going up to Norway House, Thompson, and the Paw coming in the next few months into fall. Reconciliation pillars, maximizing impact for Indigenous peoples who are blind, partially sighted, or deafblind, building an inclusive organization, and building allyship. And now I'll give you an opportunity to ask any questions.
Yeah, so if anybody has any questions, you can either feel free to unmute or you can put it in the chat here and I can read it out for us.
I have one question.
Mhm.
I'm wondering, what is the waiting list? When, like, I work in a hospital, and when I recommend that someone like follows up with vision loss rehab and or getting some services, like what kind of waiting list are we looking at?
It all depends on specifically the type of service that you're requesting. In the past, there was quite a long waiting list, but right now, from my understanding, I've been told like 4 weeks, sometimes less. So it's pretty good right now. With the exception of guide dogs, there's a long waiting list for the guide dogs. So
And for some of our programs, the waiting lists will vary as well. Like for Vision Mate or Phone It Forward, we do have a lot of interest in
yeah.
both those programs. But as we mentioned, the programs require volunteer support as well. So that's the only drawback.
So let me just clarify. I was speaking directly about Vision Loss Rehabilitation Canada services. So if you're working in the hospital and you have a client that might need, orientation and mobility specialist or an independent living specialist come out to their house or come into the hospital to show them something on their phone or whatever, that waiting list could be 4 weeks. However, if you want to, if you have a client, that's going to be discharged and you'd like them to get involved with adjusting to vision loss, well, as soon as the next program comes up, whether it be in the spring, fall, whichever season we're in, we'll put them in that one directly. And people can self-refer too. For CNIB services, you can self-refer. You don't need doctor's notes or any type of report that goes with that for our CNIB programs. So a person can say, hey, I want to attend the brunch club. They can just call or email.
Mhm. Yeah,
Thank
they
you
can
very
call
much.
directly to one of the dedicated program leads, and we can register you for any of those programs.
Yeah.
There's the exception of a few programs that have a waiting list, but 90% of them you can register and take part in them whenever they're offered.
Yeah.
Thank you.